Anxiety Disorders by Sean Brooks for Cornerstone University, Psychology 441. Anxiety disorders are more than a feeling. Many people in our culture today feel the painful effects of anxiety. How often do we walk around in a fog that is clouded up by our own thoughts that are anxious in nature? Anxiety disorders are more than feeling nervous over a business meeting or meeting someone's family. Everyone feels anxiety as an emotion on some level, and that is entirely normal. What does anxiety look like? There are many ways to look at anxiety, and it can take many shapes. We know that anxiety does not always look like shaking and crying or even screaming. Let us further discuss what it does look like and how it affects the human brain. Some of these symptoms of anxiety are manifested in sweating, chest pain, irregular heartbeat, isolation from the feared activity, or even sleepless nights. These are just the tip of the iceberg when it comes to symptoms of anxiety disorder. How many people have anxiety disorders? In the United States alone, there are approximately 42.5 million people living with anxiety disorders. Many people may feel alone in their journey with their anxiety disorder. However, they are never truly alone, although they very well might feel like that. 42.5 million people is more than 21% of our entire country. Different anxiety disorders. There is more than one kind of anxiety disorder. All anxiety disorders live under the umbrella of the name anxiety disorder. All anxiety disorders share similar symptoms, although each individual disorder is unique in its very own way. First, let's look at panic disorder. This anxiety sets on randomly. This disorder has prominent symptoms of sweating, chest pain, irregular pulse, and the person feeling like they can't catch their breath. Next, social anxiety disorder. It's also termed social phobia, and it is named for what it sounds like. The person feels immense self-consciousness, fear is overwhelming, and they have a hyper-awareness of any judgments that they feel may be coming their way. Next, there are specific phobias, where a person has an extreme fear over something that is a completely normal thing. A common area of fear would be spiders or heights, and the fear that the person has is far beyond normal ranges, and the individual will go to abnormal lengths to avoid the situation they fear. Generalized anxiety disorder. This is when there is a heightened sense of worry and tension, and in this disorder, they essentially feel this heightened sense of worry and tension without real cause or little reason to believe that there is just cause. Furthermore, anxiety disorders, unfortunately, do not have an exact cause that trigger the disorder itself. Specialists do know that it is a form of mental illness and it is a mixture of influences. Some of these influences may include some or all of the following: one's brain chemistry, stress from one's environment and genetic makeup. Anxiety disorders may run in the genes, and therefore generations of families may experience the same anxiety. Sometimes anxiety is caused by health problems, and sometimes an anxiety disorder can cause a health problem. This is why it is advisable to see a professional. Risk factors. Although it is not known exactly why the anxiety disorder occurs, we do know what some risk factors are. These include traumatic experiences at any age, stresses due to an illness, or a buildup of stress. There are also factors such as misuse of drugs or alcohol. Treatments. Some common treatments may include medication and psychotherapy. Some medications that are most widely available in today's modern society are antidepressants, and they may be classified as selective serotonin reuptake inhibitors, known as SSRIs, serotonin and norepinephrine reuptake inhibitors, known as SNRIs, tricyclic or monoamine oxidase inhibitors, known as MAOIs, tranquilizers or anticonvulsants. Psychotherapy, more specifically called cognitive behavioral therapy, known as CBT, walks the client through the issue that they are dealing with and attempts to recreate the way the client feels, and therefore they can react differently to the situation that they are fearing. The technique from our interview, I had studied and interviewed with Chris Grupp, licensed professional counselor. For this project, I posed him the questions: what psychopharmaceuticals, therapeutic techniques, or alternative therapies have you found to be successful when you have dealt with clients experiencing anxiety? His response was extremely valuable. He felt that Prozac and Zoloft were popular and effective medications. However, now Lexapro is becoming more popular and is showing significant and promising results. New breakthroughs are being made when it comes to DNA testing in order to determine what medication would be most likely beneficial to someone on an individual level. He stated that he had been giving some of his clients the encouragement to get the DNA testing, and those clients have reported better results. He felt that there is a downside to individuals when they manage their anxiety disorder solely with medication. He stated that this is because over time the medication becomes ineffective, and then this causes them to need to change their medication every few years. Chris Grupp states that talk therapy has to be done in conjunction with medication to work the client through their journey. This will allow for determination of the triggers of the anxiety disorder. He personally uses an anxiety workbook, teaches clients various calming skills such as deep breathing exercises, progressive muscle relaxation, and guided imagery. He has found that a majority of the time in his practice, most clients have experienced some level of trauma. During the process, they will also process through their traumatic experience. He then encourages the client to engage the places or events that triggered their anxiety. However, it is important that this is done solely to a tolerable level of the stress and anxiety. Finally, he has found that using these things in conjunction can allow for the client to reduce their anxiety to a level where they can function in society and live their life that they desire. In conclusion, we can see that anxiety disorders are broken down into subcategories under the umbrella of anxiety disorder itself. Anxiety disorders are more than feeling nervous for a class presentation or being anxious about a big business meeting. Anxiety is an emotion that all humans experience at one point or another. However, once one starts to experience anxiety at a level where it leaks into other areas of their life, it is important to seek treatment as soon as possible. Early treatment has the best outcome.